Hi, I'm your host, Adriana Salveral, reporting for the Ministry of Health and Social Development. The Ministry of Health and Social Development has been carefully monitoring the coronavirus situation in Wuhan, China, and is already collaborating with local, regional, and international agencies to put in place proportionate and precautionary measures. More on this edition of GIS Report. Today I have Dr. Irad Potter, Chief Medical Officer with the Ministry of Health and Social Development, and also Harmony Messiah, epidemiologist, because we spoke earlier last year all about food safety, but today we're mostly concerned about the coronavirus in China. So for persons who may or may not know, what is the coronavirus?
So I'm sure most people have already probably Googled what it is.
Right.
But it's pretty much a large family of viruses. For example, the common cold can be a coronavirus. Even more severe diseases like SARS, the severe acute respiratory syndrome, is a coronavirus. But they are characterized by a halo of spiky proteins that surround the virus itself. So that's where it gets its name corona, like the corona of the sun. Mm-hmm. So they pretty much can cause very, very mild illnesses, like again the cold, to very severe and deadly conditions, like SARS and MERS, which occurred in 2002, 2003, and killed over 800 people.
So what is it, that we don't have any medication or anything to combat it as yet? That's why it's so deadly, or persons are really taking precautionary measures against it?
It's the coronavirus that's occurring now in Wuhan, China, is a new virus. Mm-hmm. It's not been identified before. Okay. People are getting sick. They are presenting with cough, fever, shortness of breath, and because it's a new virus, there's not yet any defined diagnostics that are available to health systems and services. So by elimination, they've recognized that this is something new. Mm-hmm. So in a sense, the coronavirus is, because they can be transmitted from animals to humans, it puts us at risk because they will jump from animals into humans. And this virus was first discovered in a live animal meat market. Mm. And so we're not sure which animal, mm-hmm. And so there are currently no treatments, no vaccinations, and the care for persons who are infected with coronavirus is therefore mainly supportive.
Mm. So because it's something new and novel, this is pretty much virgin territory for most persons. So imagine you're now being exposed to something new, so your body now has to build up or be stimulated to produce the antibodies to fight off this new virus, mm-hmm. right? Which means that more than likely you are going to get sick unless you are exposed to a similar strain and your body recognizes that it's a similar type of strain and it can launch an immune attack more rapidly. But otherwise, you're going to have to go through the throes of feeling sick. Mm-hmm. And again, because it's new, the antivirals that might be out there may not work on this particular, and it has been shown they do not work on this particular strain. So all that healthcare practitioners can offer at this time is actually supportive care. Mm-hmm. So it's pretty much,
It's like, oh no. But Dr. Potter, you mentioned before, you were saying that it is contracted from animal to human, but is there any proof of, like indirect or direct contact with human to human as it being transferred, or?
Most of the cases that are being discovered now, mm-hmm. there is no animal contact or consumption of animal meat, mm-hmm. in the history, and therefore it has become apparent that these are human-to-human transmissions.
Okay.
Fortunately, most of the disease is mild,
Okay.
so only some persons would have severe severe disease. And so far, it's been mainly people who are older and people who have pre-existing conditions such as chronic diseases, like diabetes, hypertension, etc.
So then what is the likelihood of something like that even coming into our Caribbean region? Because we residents are already on high alert for anything that happens internationally. But since this is more so the core of it is in China and then more in the Eastern Hemisphere, what is it that's happening now regionally for us as we prepare or take precaution?
So right now, the risk of transmission to the Caribbean is low. At present, it is low. And that is because China has taken very strict measures to contain the virus in Wuhan and in the provinces, the 13 or so provinces that, they have found the isolated cases. They've actually locked down about 3 to 4 cities. They have canceled large events, and they have actually restricted transport out of Wuhan.
Okay.
So right now they have it pretty much contained. But we do have isolated cases that we've been notified of in the USA. They've had 2 cases. Japan have also reported have cases. The UK is testing for cases. Luckily, 5 of them came back negative, and those were in Scotland. So we're still awaiting results for the other 9. Saudi Arabia said they have 1 case. So we have very, very few isolated cases. So right now it isn't a pandemic, but we're still trying to work together with other countries and international health agencies to try to minimize spread.
So what is it, in addition to that, here locally, what support has maybe the Ministry of Health given, maybe ports and other agencies that might have direct contact with people who travel a lot?
Fortunately, we've had experience with pandemic influenza fairly recently. SARS happened from 2002, but more recently we had H1N1. And because it's a respiratory type infection, we already have a plan for pandemic influenza. The strategies that we are going to use to combat coronavirus are going to be similar to those required to combat pandemic influenza. So there is a national pandemic influenza plan. The Health Services Authority does have a pandemic influenza plan. And so it's fairly easy for us to refresh that plan in the context of the coronavirus, because the main strategies are going to be very, very similar. In terms of, so far we've had meetings we've invited private sector and public sector partners to meetings, and just this morning we had a discussion with them about to increase their awareness about the characteristics of the virus, how it is spread, how it is treated and managed. So in that discourse, we identify that really and truly treating coronavirus supportively is the same as treating the flu supportively. You're concerned that because it is spread by coughs and sneezes, that people practice proper hygiene. So it's a lot of hand washing and a lot of covering your cough. Okay. So there'll be in the media and on the social media and in print media and other media a lot of advice to the public regarding how do you protect yourselves. Protecting yourselves means frequent hand washing, coughing into your elbow and not into your hands, minimizing contact with people who you believe are sick, right? And also avoiding eating wild meat. Not a custom in the Virgin Islands, right. But if you when we travel, we need to be concerned that we don't consume wild meat. At the same time, for the partner agencies, the border protection agencies, we'll be meeting with them shortly to have sessions with regard raising the awareness of the risks. We are concerned that, one, we protect our border patrol staff. We are concerned that our interactions with the traveling public do not create unnecessary bother for either trade or travel. And we are concerned that if we have someone who is symptomatic or who is not feeling unwell, that they are comfortable to conduct a short interview with them and refer them appropriately to the health services. So we'll be having those meetings with the heads of the Port Authority, Airport Authority, Customs, Immigration, etc., early next week to refresh because we've had these types of discussions before when we had other outbreaks internationally.
And I'm privy to, even with a lot of the barges that come in, because of our rebuilding efforts, we get a lot of trade and barge and materials that are coming in, even from all over places that probably we wouldn't get it from before. And I know the agents and stuff are very good at, kind of containing everyone until they have either their proper documentation and or finding out if anyone is ill. Public health is usually, or more than likely, there in that mandatory contact list if anyone isn't feeling well. So if you could refresh the public, because maybe persons don't know, because they're not in that area, they're not privy to, like the protocols of ports or any of the ports.
And it's very important that we meet with these agencies because we want to protect our own.
Right.
So not much is known about this particular virus. We call it the 2019 nCoV or the WWN-CoV virus. A name hasn't really been decided internationally on what to call it. But because not much is known, we have to keep updating the public and updating the agencies about how it's transmitted. When a person is infectious, when are they contagious, because it's then they're better able to protect themselves and others. So we're going to be working very, very closely with our local agencies, who then we hope will also help us to disseminate the correct information to the public so that they can do their due diligence. Because for right now, it really comes down to a lot of personal hygienic practices. And even when we discuss about the foodborne diseases, it also came down to personal hygiene, the same hand washing, the same covering your coughs and sneezes. So you can definitely see that the preventative measures that we are trying to that we continue to put out there in the media is almost the same across the border for many of these diseases. So it's just a matter of getting the public to be aware that this is what they need to continue to do on a continuum, and not just to start doing it when there's a fear of an outbreak.
And I'm glad you said that, because my next question was going to be, what about our locals that travel a lot? I don't know if maybe, especially business owners, people source a lot of their products from China or the East, and they're now, it's like a new trend that they're actually going over there to see the factories or the suppliers, and they're going there. So what other precautions can they take? I mean, be clean, but what else can you do? Don't eat meat.
Our current advice really, if the travel is not essential, don't go.
Don't do it. We can't tell you not to go, but
because it's a novel situation, it's a novel virus, it's a new virus. We don't yet know what the incubation period is. We don't know how long before a person becomes infective. So, in fact, there's a lot that we don't know, and so we are going to try to constantly update the public as we get more information about the characteristics of the virus. For now, we are very sure that there are some very specific, particular general measures that will help. But certainly, if you don't have to go, don't go. Not just don't go to China. Restrict travel to any of the countries that have cases unless you really need to go.
So are we going to publish a list of these, the countries or locations that at least, I mean, you said that they're very mild, but should we then let the public here, locals, know that these are the countries that have that have a case of it, and maybe they should hold off on that trip?
But also, we have to be careful not to create unnecessary worry. A country that has 1 or 2 cases identified probably have a small number of cases. You wouldn't be able to identify necessarily if a person's cough or sneeze or shortness of breath is related to coronavirus.
Right.
Therefore, the message is for all persons that you're in contact with who are coughing and sneezing, be mindful that you may be exposed to something that is novel and new, for which we have no specific treatment. And therefore it's important that not only do people restrict unnecessary travel, but when they do travel, to be mindful, to be observant about washing their hands frequently, close contact with persons in close enough proximity that a cough or a sneeze may reach you, or surfaces can be contaminated. And since we don't know the primary source of the virus, restrict eating wild meat.
And also, if you're going to be traveling, please get in contact with the local Ministry of Health there, because they usually have Facebook or they have pages, so you can get updates to your phone or what's not, so you can be abreast and know when the situation changes, so you can know when to get out of Dodge.
Right.
But for me, like Dr. Potter said, I would not advise traveling to China right now, because we don't know the extent of the spread, 1. And 2, the local measures that they have put in place may make it very hard for you to leave. Because remember, they have shut down quite a bit of cities, and they're heavily monitoring traffic in and out. So
what do you tell, we're a tourist destination. And I mean, of course, we have our local health agencies that might be on high alert, and we tell our ports to a degree, like immigration and customs. But then what do you tell the taxi men or the tourist board greeters, or maybe our mom and pop shops that, tourists may not take the taxi to go to the beach, but they just may walk around town? What can our local business persons do as precaution?
Well, part of it is that every person within the territory has to take responsibility to try to safeguard themselves. Let us start there. So we will work to increase persons' awareness about the signs and symptoms of the disease. We will work to advise people about hand washing. We will do demonstrations with regard to hand washing so that people know to wash their hands properly. Since pandemic influenza, we've had these gel machines in ports of entry and large institutions. Those will be encouraged so that they actually have gel inside of them. But a big part of it is increasing awareness and enabling the possibility that people can have access to water and soap to wash their hands. Outside of that, if persons are not feeling well, we encourage them to review their symptoms, and if they are uncertain, to seek help from a healthcare provider.
And tell persons don't take antibiotics.
Don't take antibiotics. It's a virus. Don't
Oh,
do
man.
it.
It is a virus, so
I have to
antibiotics,
connect it all. I mean,
antibiotics will not kill it.
right.
In fact, it might further compromise your body.
Yeah. And even in terms of disinfecting and sanitizing, the coronavirus is a very fragile and weak virus structurally. So even cleaning surfaces with water at like 60 degrees Celsius and using the correct amount of, or the recommended amount of bleach to water and what's not would be enough to render it ineffective. So these are steps you can also take. What we call it, the antibacterial hand sanitizers, it needs to be above 70%, okay, of alcohol content to be
I
effective.
walk with those to travel with, like as I get into the plane or
Right.
on the boat handles and the trays.
Me too. So if you're a service provider and you're interacting with the public a lot, you should have those things on hand.
Okay.
So, if you're engaging and you're touching and what's not, you just go, you rub and make sure that you are protecting yourself after every contact and keep your hands away from your face and other parts of your body.
So we are also requesting that proprietors, members of associations and groupings where people work together, that the establishment should ensure that hand washing, soap and water is available, and that the gels are available, and that if people are ill,
Right.
that they not be pressured to come into work. Because if they are ill and they've been to the healthcare provider who say that they ought to be off from work because of their illness, we really should be reasonable about it. Because you don't want sick people coming in to pass infection on to the rest of the workforce.
And then if maybe persons even, like if they coming into the ports, if as a precaution, maybe in the coming days, our borders, maybe they'll have masks or gloves on. That person shouldn't really be alarmed, but that's just another precaution against anything, not just this, just anything, right?
Well, really, we ask people who are sick to try to protect the rest of us by wearing a mask.
So the ones who are sick are wearing the mask?
The ones who are sick generally are the ones who are wearing the mask.
Because I wouldn't mind wearing the mask.
That's the surgical mask,
I wouldn't mind
the
wearing
nice
that
cloth, the cloth mask that you see.
I recently traveled. I saw a couple people wearing a mask, and in my mind, I said, "Why I don't have one?"
So when we see somebody who's not feeling well with a respiratory tract infection, we may offer them a mask.
So if I just wanted a mask, it's okay for me to go get one.
If you just wanted a mask, they're available at most of the local drugstores.
Why are you wearing a mask, Adri? I just can't. I think that's enough information. I mean, for me, I'm not really necessarily too bothered unless I was traveling. And I know we don't necessarily have like a great Asian population here where we're like, okay, well, there's a lot of traveling back and forth for them as well. But everybody take the necessary precautions, clean, hygiene, wash hands, soap gel, coughing your elbows. So I mean,
there's one other thing which I really want to stress, and I know there's a tendency to say, keep them out.
oh no.
But keep them out really means that everybody who is out at any given time, that message of keep them out pertains to them.
Right.
So we may have nationals who have traveled on their way back home. I don't think we want to keep them out. What we want to do is to be able to identify persons who are ill early. If they need to be contained, we separate them and we treat them. But we don't want to interrupt travel or trade. And besides, it's not really that easy to close your borders.
Right.
The persons who are coming from countries where there is spread of the coronavirus, most of those countries are going to have exit screening. So for most of them, by the time they get to us, they would have been screened before they left there. The other thing is, we have to be careful because a lot of people, a lot of countries have thermal scans at airports, etc. They're not really recommended for us because they're not 100%
They're not effective.
effective.
They only
And-
pick up 1 in 10 at most, and sometimes it's not even related to the virus you're trying to catch.
So it's more important that if you are not well, to do the simple things of covering your cough, wearing the mask if you are the one who is sick, and being sure to clean the surfaces in your space.
Oh, yes.
If you're shaking hands, clean your hands frequently.
Air kiss.
Keep your hands out of your face.
Not even air kisses, not even, because
Not even?
saliva,
Oh my God.
not even.
Okay, no air kiss. Scratch that.
So really, the effort is not to close the border
Right.
because it's we know what the BVI is like. We have a million little ports.
We do.
So it is really to have sufficient awareness that should there be a problem, we can identify it early and manage it appropriately.
And we also want the public to be diligent. So if it's tourist season for us, and even as customer service, if you realize that, the tourists who are coming off, maybe you notice that quite a bit of them are sick and what's not, you can call the Ministry of Health and alert us, and we can conduct our investigations and find out exactly what is going on.
Right.
Because sometimes not everyone is as truthful as they need to be. Because if you pay for a cruise, be skippy, you want to see, you're going to come off even if you're sick. So it is very good for the locals to be aware of what's going on around them and contact us if they have any concerns, so that we could then come out and do what we need to do to ensure the safety of our population.
And particularly with the cruise ships, we do have a good relationship with the industry. They are required to report to us 24 hours in advance of arriving in the Virgin Islands, in the BVI, if they have illness on board, what the diagnoses are, how many persons, if they have any quarantine measures aboard the ship. All of that information we get before they come. We assess the information and make a decision as to whether or not we need to board the ship and do our own inspections.
Okay.
All that happens before they're allowed to dock at the pier.
Well, that's great. I hope that put me at ease. So I'm hoping that it puts someone else at ease too. Didn't a situation like that happen at another Caribbean cruise late? Was it late? Or last year sometime?
St. Lucia.
Right.
Measles.
It was
case of-
measles.
In case of
right.
measles, yes.
So
So even though we're not like blatantly always in your face, we're always behind the scenes making sure that everything runs smoothly and that we're protected. We're constantly moving and monitoring and evaluating and seeing how we can make things better for the public. So when we feel the need or there is a need to really come out, then we advise
Right.
and we recommend and we guide. But we are never, ever stationary. We're always working to protect the health of the public.
So in fact, we do have an obligation to monitor what is happening in China, to monitor the spread around the world, and we will be issuing regular updates so the population can be aware of what is happening with the virus in terms of where it's spreading to and what the conditions are. And as we get more information, you'll be hearing from us.
all right. Well, even if we don't, I mean, social media is so instant. Is like
Don't do it. Don't, because everything that's put out there isn't necessarily true.
all, of course.
Because even when I was doing my research, because in my field, I do have to monitor, I do have to survey, I do have to look at the cases, the death rates, see what's going on globally, and track it. And so many erroneous things were being put out there, and sometimes it's really hard to filter out what is fact from what is subjective true, and then what is fiction and definitely not real. So even last night on Facebook, I was seeing a couple things put out there, and they weren't entirely correct, but they had enough truth to sound right. And we're like, okay, we definitely need to to come out and let people know this is what is happening, this is how many cases, this is how many deaths, this is what is going on. And you can trust that the Ministry of Health will be putting out what is factual and accurate and, right, and to guide the people.
I must commend some persons. I'm in a couple of group chats and I have gotten several tidbits about washing hands and what is the coronavirus. And I'm like, even my daughter's school, I was like, oh, okay, this is interesting. So, I mean, persons, they're getting there. They're in the know.
And we are happy about that. And we've noted the large number of infographics that's coming in WhatsApp, etc. And we are happy that they are mainly from credible sites like WHO.
Yes.
So that helps.
Yes.
No Wikipedia, people. No Wikipedia.
You'll be in trouble. You'll be sitting there like, what? The Wikipedia have a snapshot from the movie, The Planet of the Apes. Because when I heard this, I instantly thought of that movie, at the end of it where someone is in Asia and then they cough and then their nose bleed. And I'm like, I wonder if this is. So, persons already have that, idea of something dramatic concerning an illness. So they just think of the worst and they go back to these movies where people are quarantined and then they're just dropping like.
So if you have a question or a concern,
they're free to call the ministry to clear up any misconceptions. So I'm so glad that we had this conversation. Because I'm like, some people on Facebook are like, coronavirus, then they have a Heineken virus later. I mean, they're making fun of it a little bit, and then some are not making fun of it. Some are really like, okay, well, if you're traveling, please, take precaution.
I think there's a tendency for us here to be kind of complacent because, many of what we call the big nasties haven't really touched down.
Right.
But we should never lull ourselves into a false sense of security. We always need to be on guard because we can only do so much, and at the end of the day, the public still have to do their part. Exactly.
Well, I think that's a great note to end on for this interview, yes.
Thank
I want
you.
to thank you both again for joining me.
Thank you for having us.
Harmony, Dr. Potter.
Thank you for having us.
Thank you. That closes out today's GIS report. My guests were Chief Medical Officer for the Ministry of Health and Social Development, Dr. Irad Potter, and epidemiologist for the Ministry of Health and Social Development, Harmony Messiah. We spoke about the coronavirus in Wuhan, China, and what precautions the Virgin Islands are taking for it. For more information about this and other government news, be sure to visit our website at www.bvi.gov.vg or like us on Facebook at Government of the Virgin Islands or Ministry of Health, VI. Again, I've been your host, Adriana Salvaral. Thank you for tuning in.